Hello, my name is James Black, and today we're going to be talking about using blockchains with healthcare. So the first thing is, what is a blockchain? So basically, you'll have some data. So you might have your doctor ID, your patient ID, and an appointment. But then, you'll then have another block. So it's like a ledger. It's like an accounting ledger. So you would have, each of these would be a column. So you have doctor, patient, appointment. And then you would fill out each of these columns. But the only thing is we're adding one extra field in here, which is a hash. So we need a way to uniquely identify every column, make certain that, or every row, make certain that nothing changes. So we would then, this would then just point to, you would just have this data, this row pointing to that row because the hash. So you'd have the hash of the previous row. And so you just chain these together. That's a blockchain. So the thing about healthcare is, fundamentally, people go into healthcare not because they want to do a lot of, deal with a lot of paperwork. They don't want to. They go into it because they want to help people to feel better. That's the primary goal of healthcare, is to help people to have the highest quality of life given their specific circumstances. And a lot of the processes that we've developed to try and help improve on that has created more paperwork, more problems for the providers, for the doctors and the nurses. So we keep getting our system bigger and bigger, and it becomes very expensive. So what we're looking at is, how do we get back to the core mission of healthcare, where we not only do we want to have where the doctors want to go in, nurses want to go in and help people to feel better, but how do you also create a system so that the population as a whole is healthier? If you have healthy people, they have fewer sick days, they're more active, but they're also creating more. And so you have a more vibrant population. So as a nation, we want to have a healthier population also. And part of that is, how do we also give tools so that we can get better medicines and better treatments? But healthcare is also a business. So like every business, you want to try and figure out how to maximize profits and reduce costs. So we're going to try and figure out how to do all of this with blockchain. So the thing is that blockchain, there's a lot of different types of blockchain frameworks. You have, and they all have their strengths and weaknesses. There's no one perfect platform that will work, just like there's no one operating system for everyone. There's no one car for everyone. If I'm going to drive a minivan, my needs are different than if I'm driving a Lamborghini. They're very different. So what I'm doing is, I'm looking at the healthcare experience. And we can break this down into different workflows. So for example, we'll start at the top of, fundamentally we want to have an insurance company sends money to the doctor, so, or the hospital, or whatever. So something was done. The doctor needs to get paid from the insurance company. So one way to do this with a blockchain is to use something called RippleNet. I like RippleNet only because it's a company that they designed their entire blockchain with the idea of, how do you securely transfer money, basically. So for example, while you're transferring, it could be they're sending money, the doctor wants to be paid in chickens. So they can actually have a conversion, and so the doctor would get paid in chickens. And the time, if you're working with money, not chickens, this entire process is less than 4 seconds, okay? Which is really fast, considering the fact that right now, last I looked at, Bitcoin was taking somewhere on the order of an hour to process once you've spent your Bitcoin. An hour later, it's in the ledger. So it can get really slow. So that's one area where it could be beneficial is you take out a lot of the banks and stuff in the process, and you just go from here to here. We also have, though, where I started at is I'm sick. I need to go see my doctor. So I call and I make an appointment. Appointments, though, are very complex things. In order to make your appointment, they have to say, okay, well, is your insurance, do you have the same insurance? Is your insurance valid? They have to do all these checks to make sure that everything is correct. Then they can look at the calendar and they say, okay, the doctor's available at this point. And then I look at my calendar and see. So there's a lot of complexity. So what I did, this entire thing of setting up appointments is very complex. I'm going to be, for my needs, I'm skipping that actually, only because it's more complex than I needed for a proof of concept. What I'm looking at is you go in, you see the doctor. So you enter the office, you check in, you see the nurse, see the doctor, and then you either check out or you'll end up going to a new appointment. Let's see, you have a new appointment here. And there could be a prescription involved. So you may end up doing one of these two things, and then you'll do your checkout. So this is the basic flow that I was looking at. I call this entire thing here a medical encounter. So ultimately, you went in with a backache. So you went to the first doctor, you went to your primary care physician with your backache. He refers you to a specialist who then refers you to an imaging lab. Oh, while you were also here, you also were referred by this guy to a pharmacy for some medication to help with your back. And then you come back out of here, it goes here, and then you'll end up going back here. Okay? So you end up having multiple encounters. So each of these areas, 1, 2, 3, 4. So you have 5 medical encounters to try and deal with your backache. This is actually fairly small. Generally, it's a lot more steps than this. So you're going to go through this basic approach of check in, be seen by the staff, check out in every one of these. So what I'm looking at is how do we put this into a blockchain? So basically what you end up having is you'll end up having, so you have your patients, your patient, your provider. Providers are people like doctors, pharmacists. You'll have an appointment. But I also want to have medical supplies and tests. So these are the things these are what's called participants, and these are assets. And so what's going to happen is when I go in, there'll be a timestamp. So I go into the check-in, it will say, okay, I've checked in at this time. Then I'm in a different status while waiting for the nurse. So when I'm called to go in to wait for the nurse, I have a certain time. So I entered it here, and I'm seen, and I leave. For each of these, you have this, so you can track. How long did I spend talking to the nurse? How long did I spend talking to the doctor? So if someone wants to look at how much time does this doctor spend talking to patients, they can look at, over some given time span, they can actually look at this information and see what was done. And that's kind of the important part here is, in a blockchain, what you have is so all the providers, we'll call them MD, you have the payers, P, and you have a regulator, G, and then you have the patient. So all of these people need to see the information all the time. In a blockchain, what happens is that this data, this ledger, is actually shared. He has a copy, he has a copy, he has a copy, and I have a copy. So that way, at any given time, I can look and see what are my appointments coming up, or what have they done to me that is, so I can see how my treatment's been progressing. The regulator can sit there and say, well, is this doctor spending enough time with patients? And the insurance company, well, they just want to make certain that you're not using tests that are useless. And that becomes a problem with the current system. Right now, when you get an x-ray, so I go to the doctor, I had an x-ray. Now, a week later, I'm lifting weights, I hurt my back again. I go see my doctor again. He's probably going to sit and say, I need another x-ray because it takes him too long to get to this x-ray that the imaging people have. So the insurance company's going to pay for another x-ray, even though I had one just done a week ago. And they may want to compare the differences. So by having this information in a blockchain, then what ends up happening is this doctor would send a request to the blockchain and say, I need this particular x-ray. The system would then query, and either the patient or the imaging people will have to approve. This becomes critical here. Who owns this data? This x-ray is owned by the imaging company, and also by me, because it's my x-ray. One of us has to give approval for this to be used, and so I'm on my phone, the doctor makes a request, I get it on my phone, I say okay. And then it goes into their system, gets the information, and the doctor gets just that x-ray. He doesn't get all my x-rays, he doesn't get anything else, he's getting just the piece of data he needs. That's critical also. I saw exactly what he needs. If he had asked for an x-ray of my foot also, he's not getting that because it's not my problem's my back, not my foot. I'll deny the foot and I'll say I'll approve the back, unless he can give me a good reason. I own the data. But in the process, the imaging company may have gotten a small micropayment, by the way. They may have gotten paid, we'll say, 0.0, they may have gotten paid half of a penny, for example, to get this data, because it has some worth. So that's possible also. So, but that's the basic idea, is what we're trying to do is to see if I put all the data in there about my medical encounter, what prescriptions I got, was my temperature high or low, what's the various health codes that each stage was given me. You know, he had a certain health code that he put in about my back. He had a certain health code when he did this. There's constant codes for everything going on. So we could track all this. It's not a big security risk because my name is not actually in here at all. I have a blockchain ID, and that blockchain ID is unique to me, but only I really know it. it's used just to track what's going on in the system. So there's no way to trace my x-ray back to me personally. No one can hack into this and say, oh, let's go look at James's x-ray. They have no way to know what my numbers are. So this becomes, so we're trying to make it more transparent to the insurance company, the government, and myself, and for the doctors to be able to see what other doctors are doing, while still maintaining this whole idea about data ownership. So some of the benefits is that by doing this, now I can look at entire treatment paths. I can start to, if I know that for a particular symptom, normally you get an x-ray, you get this test done, this test done, this test done, and only this last test really is going to show anything useful, but we do these things just because it's what we've been doing. Well, that's wasting the money of the insurance company. They're paying for all, there are 2 tests that are more likely useless. So they could just pay for the last test, and we could solve the problem sooner, which means that I get healthier faster, which goes back to the purpose of medicine is to help people to get healthy faster, or to stay healthy. But you could also start using some machine learning models to analyze more information and see, is there a better way that is not typically done? Some doctor somewhere, he had a friend who was a veterinarian who said, well, if you do this is what I do with horses, so this helps them to get better faster. It might work for people. And so he tries doing it, and it works. So whenever a person goes into his clinic, they get healed half the time because he's doing some special trick that he knows. Well, this system could have analyzed that and said, hey, if we started doing this more often, this might be a better approach. So we can have new opportunities, new tools being created for doctors. We can also, because you've collected all this information, you could make it available to researchers for a higher cost so that they can come up with even better treatments. Overall, but in the process, you've cut out a lot of middlemen. So this is the doctor talking directly to all of these different entities. The doctor doesn't have to create any reports now and send them to the government because the government can just pull the data directly and get their own reports. All of the code that's creating those reports sit in here so everyone can see how they actually create their reports. Everything becomes transparent to everyone else. The only thing we're doing is we're hiding identities. That's important. And some data, like my actual x-ray, is sitting at the radiologist. It's not on the blockchain. The blockchain has an ID, a pointer, the ID for the x-ray, but the x-ray itself doesn't sit in the blockchain, mainly because they're big. But there's an easy way if you have permissions to get to that. That's important also. Everything in this is based on permissions. So if I want to make a new appointment, 2 people have to approve it. If I want to change an appointment, there has to be two approvals, myself and the doctor. If the if the insurance company wants to see some information, to get some additional information, they have to get permission from 1 of 2 people. If a researcher wants to get information, they have to get information from both people. I may not want my information to be included in that research for whatever reason. So for researchers, both people have to be involved. Everything that you do requires permissions. The nurse entering in his information, he has to have permission. The doctor can't enter in the nurse's information. The person who's doing a check-in can't enter in the nurse's information unless the person doing the check-in is also a nurse. So everything is based on permissions, and these permissions are maintained by the blockchain. So to wrap this all up, we can reduce a lot of the costs that we have. By cutting out a lot of middlemen. We can introduce more shared savings. So as doctors and insurance companies work together to reduce the costs of helping people to get better faster, the insurance company pass some of those savings on to the doctors. We can go back to the original mission of healthcare and cut out a lot of the extraneous paperwork, a lot of the time that doctors have to spend after just taking care of all of the required paperwork. We can try and cut that down so that they can go back to just taking care of treating people. That's why they wanted to go into the medical system in the first place. So the goal is to use blockchains to help do that. Thank you very much.